Hello, everyone, and welcome to today's webinar about understanding and supporting student athletes' mental health. My name is Ron Goldman. I'm the co-founder and CEO of Kognito, and very happy that you join us today and very happy to welcome our panel. You will hear from them, and we will have time at the end to go through questions. The presentation today and the webinar today is being recorded, and we will send you a copy of that recording. You could please go ahead during the webinar and submit questions. You can see on the screen, and you can use on the right part of your screen, click on the question box and submit questions. We'll have time at the end to answer that. Today, we really have a great panel with us, and you will hear from each one of them. First, we have Victor Schwartz from the Jed Foundation, who is also the Clinical Associate Professor of Psychiatry at NYU School of Medicine. We have Christine Williams, who is the Associate Commissioner at the Mid-American Conference. We have a student athlete from Ohio University, Emily Deering, and Glenn Albright, who is a co-founder and Director of Research here at Kognito. Before we hear from each one of the panelists, just quickly, for those of you who are not familiar with us at Kognito here, we're based in New York City. We've, for the last 10 years, have worked with many academic institutions in providing simulations to help educate faculty, staff, and students around different skills around supporting student mental health and wellness through online simulations with virtual humans. And over the last 6-12 months, we've heard from a lot of our colleges and clients about the increasing need around student athletes and have started looking more and more into this. And as part of that, really very happy to have a great panel with us today so we can learn more about what are the challenges, what are the opportunities, and what is really the current status when it comes to mental health and student athletes. So with that, let me go to our first panelist, Dr. Victor Schwartz, if you would like to take the lead.
Thanks, Ron. It's a pleasure to be here with you today to just spend a couple minutes giving you a brief overview of some of the particular concerns around student athletes. I've had the opportunity to do some work both with Ron and the people in Kognito, but also with the NCAA, who have been, for the last couple of years, looking at some of these issues with greater depth. Brian Hainline, the medical director, and Mary Wilford, who really focuses on mental health, have been really doing an excellent job. And I actually suggest people take a look at their resources if they want to learn more detail about some of the concerns around student athletes and some of the work they're doing. If we can go to the next slide. Just a couple of things that some of the work that the NCAA has found, and you know, there's, as so frequently the case with college students, there's concern here. As you see, 30% of student athletes reported feeling seriously depressed at some point in the last year, and 50% reported feeling overwhelming anxiety in the prior year, and certainly not surprisingly, 33% felt that they struggled to find the energy to do other tasks. But you know, just to put this in perspective, the data from the American College Health Association's National College Health Assessment shows actually somewhat higher numbers among college students in general around these sorts of complaints. So the National College Health Assessment finds 40% of college students were, you know, depressed at some point in the last year, sufficiently that it was difficult to function, and actually 61% reported significant to overwhelming anxiety in the prior year. So athletes are not more emotionally challenged, but they are similarly and maybe even slightly more of a robust group, and there are ways in which that makes sense. People who have participated and excelled in high school athletics tend to be good at things like time management and working with others and following direction, and have a lot of the life skills that sometimes may actually contribute to significant resiliency. The concern, though, that's come out in work that was done at University of Michigan, and I think this has been corroborated by work the NCAA has done as well, is that the big challenge around student athletes is that for a variety of reasons that we'll talk about, they do tend to be more hesitant about reaching out for help when they're experiencing uh, symptoms of mental health difficulty. So, as you see, this is work that Dan Eisenberg and Sarah Lipson and their group have done. Uh, they're some of the real major researchers in the epidemiology of college student mental health, and they've seen that only about 10% of student athletes will reach out for help when they're in distress, as opposed to 30% of non-athletes. If we can go to the next slide. So, in seeing that difference, which is a pretty substantial difference among student athletes, it certainly uh, bears on us to wonder why this is. And I think the survey that Dr. Albright will tell you more about will get into some more of the details of why some of this may be the case. But clearly there is a general cultural issue among athletes that you're supposed to be tough and resilient, and and not be in any way vulnerable or weak. So it certainly stands to reason that that might be a limiting factor in athletes being prepared to reach out. And again, if also they're not talking with their friends, with others, with schoolmates about their concerns, sometimes it's hard to assess the severity. And in a sense, the next three bullets, that they're not sure if they're severe enough to really be asking for help. And in many cases, people don't recognize, and this is true of college students and young people as a whole, of sometimes there's just an assumption that you're supposed to feel crappy. You're supposed to be anxious or depressed because life is very stressful at this point in life. So it's not necessarily clear to them what's the threshold for reaching out for help. And there's a sense, I think, too. And as you see, this is commonly stated that they don't want to be taking resources away from other students who, again, may feel have more severe or serious problems. There's some structural challenges too to being able to reach out and get help. In many cases, athletes have very demanding schedules in schools that might be somewhat smaller. Literally, the hours of the counseling service might not correspond to hours that they're available because of practices and classes that make so many demands on their time, and also in some situations where there may not be the capacity in the sort of more elite athletic programs that might have their own counseling facilities or somebody dedicated to them. Being a known person on campus and walking into the counseling service may actually feel foreboding or challenging. It's important to recognize these are not independent or exclusive of each other. In many cases, the students who are not seeking help will suggest several of these reasons for not reaching out. Just if we can move to the next slide. So there are a number of stressors that are unique to student athletes. I mean, college can be very demanding. Students are often carrying significant loads of work, and in many cases are also working. But students who are participating in athletics to this degree and this level are often really have some significant demands. One of the first challenges that comes up for many young people, many college athletes were really kind of superstars or at least stars at the high school level. And the shift from being just one of the top people in maybe your county or state to being a kind of standard average performer can be really difficult for people to integrate and adjust to. The demands of athletic performance, as I said before, the time that's involved is no surprise to anybody. The athletic demands are physically challenging. and that carries its own difficulties. You see in the fourth bullet the impact of sleep deprivation when they're trying to get everything done, and balance the demands of being a student and hopefully actually being engaged in your academics. So the reality is that for most student athletes, they're not going to be pursuing a career in athletics after college participation. So academics, are obviously an important focus for them. There are, intense relationships that come up around team play, uh, and again, along with those time demands, somewhat limiting the social opportunities that can come up for student athletes. In fact, it's not unusual, and this is more common, obviously, in these kind of hyper elite programs, that student athletes on campus are almost segregated from other students because their time and life is so regimented. Even in the kind of standard student athlete problem situation, the life and time is certainly way more regimented than most other students. And for athletes, there is always both the concern of an injury and the after effects of having to deal with an injury. Uh, can be extremely challenging, both physically but also emotionally as well. If we can go to the next. So, just a couple of words before I finish up about why it would be valuable for student athletes to be seeking help at a more regular and consistent basis, and to get help sooner, because we certainly know that getting help before a problem becomes a crisis, it certainly can play a role in averting potential crises. But there's growing data that students who are depressed or not functioning, obviously it can have an impact on their academic function, both in terms of GPA and retention. So we know that students who are struggling with depression tend to have lower GPAs, while students who have a diagnosis of depression but are being adequately treated perform actually just as well academically as their non-depression diagnosed peers. Again, this is work coming out of both the work of Dan Eisenberg at Michigan and Amelia Area in the College Life Study in Maryland, that retention and GPA are improved when people get mental health treatment. Campus safety is obviously a concern in terms of more severe mental health problems that can come up, that can have an impact on others on campus. So it's obviously, to most of you who are listening, well known the risk of suicidal behavior on campus in terms of both the risk to the individual and others on campus because of suicide contagion. There's certainly ample evidence out there that getting mental health care can improve not only academic but also athletic performance. And I think it's important to recognize that this is separate from the kind of sports psychology which is focused on enhancing athletic performance per se. But if somebody has got a better handle on their anxiety, on their mood, is concentrating better, they will perform better. And obviously, again, if you're feeling better, if you're able to concentrate, class attendance will be better. And when people feel better, their satisfaction and quality of life are improved. And I will now hand it back to Ron, who will move us along forward.
Great. Thank you very much, Victor. I would like to move on to Glenn Albright, co-founder and director of research here at Kognito. Glenn?
Thank you, Ron, and thank you, Victor, for that presentation. At Kognito, we're very fortunate to be able to access a significant amount of survey data before people complete our mental health simulations. And in this case, a survey was administered between February 2014 and March 2018 and to students. And in response to over 63,000 students completed the survey, of which 3,391 identified themselves as student athletes. and they were drawn from over 75 different colleges and universities. So in this baseline data or pre-survey data, we really had an interest in answering three critical questions. That the first one, are students, athletes adequately prepared to support fellow students? And are they ready, or are they already connecting students to support services at sufficient levels? And in fact, do they think it's part of their role on campus to do so? So in the next slide, we see some of the data as a result of the baseline survey. And in terms of preparedness, we see that over 50% didn't feel adequately prepared to recognize when a student is exhibiting signs of psychological distress. And that includes signs and symptoms of depression, anxiety, and thoughts of suicide. Over 60% reported not feeling adequately prepared to approach a student that they were concerned about and have a discussion with them. And 54% felt that they were not adequately prepared to have a discussion about a referral to mental health support services. So those three preparedness items show that, number one, there's a need for preparedness. But number two, and this is the good news, is that 88% said that they identified that part of their role as a student athlete should be to connect students experiencing distress with mental health support services. So in our next slide, we look a little bit more carefully at the behavioral data. And this again is from baseline or pre-survey data, in which 54% did not recognize any student exhibiting signs of psychological distress in the months prior to the survey. That would be in the 2 academic months prior to the survey. And not surprisingly, almost 2/3, 61% were freshmen. And 59% did not approach any student to discuss their concerns about psychological distress. And again, 2/3 were freshmen. In terms of actually having discussions about a referral to support services, we see here in terms of freshman student athletes, over 80% made absolutely no, or had absolutely no discussions about referrals to support services. And going down to our sophomore, junior, and seniors, we see that 2/3 or slightly over 2/3 still had no discussions with any students regarding possible referral to support services. So this is very alarming that these students, number one, they indicate that they're not prepared, and they're acting out of it in terms of not having those necessary discussions. So in the next slide, we can kind of conclude from this data that students are ready to assume the role. They're not prepared, but they want to be prepared to identify, talk to, and discuss a referral with fellow students that they're concerned about. Secondly, the current number of students, athletes being recognized, approached, and referred is well below the number of those athletes who experience psychological distress, as we saw with Victor's data. And number three, academic institutions should take advantage of this fact that students, they are not prepared, yet they want to be. They demonstrated a desire to learn these skills to better support student-athlete mental health, and the data really begs that they be provided the types of services that would enable them to do so.
Great, thank you very much, Glenn. Moving along, Christine Williams from Associate Commissioner at the Mid-American Conference. If you'd like to take us to the next phase of this webinar.
Absolutely. First, I wanted to say thank you to Kognito for hosting this webinar. It's a unique opportunity for everyone. And then again, for the invitation to share what we at the Mid-American Conference have been able to do in starting this whole process. So an overall look at what we have started. The conversation actually began about 5 years ago with our MAC-SAC, which is our Student Athlete Advisory Committee. And I went to them and said, what's going on your campuses? What's going well? What's going poorly? What are we just not talking about? And the big one that came up time and time again was mental health. They're anxious, they're depressed, their teammate is having an eating issue, not sleeping enough. the list went on and on. So the conversation began with our student athletes, and it's really been the driving force behind everything. And you'll hear from Emily in a little bit of where they have been able to take it. And obviously with it being 5 years, that's been a class that's already graduated through. So it's not just a one and done situation. It's something that we need to continue to work on and have the conversation about. And our big push at the MAC is it's okay to not be okay. And it's more a look at be able to have the conversation, be comfortable in your own skin and say, I'm not having a good day, or I'm not having a very good week or semester, whatever it is. But the challenge has been in the past 4 years as we continue to grow this conversation and get the buy-in from our administrators is to get the buy-in from our coaches and the community around and the fan support. Because it's not just about the student athletes. They understand that they represent a larger group than just themselves. So it's the continued buy-in to destigmatize the mental health, rub some dirt on it, get back in the game and play issues. So if we go to the next slide. Our efforts in this destigmatization piece it's not a one and done situation. It's a continued message, but we take a week in the year to really focus on it on each of our campuses. And the student athletes, again, drive this whole conversation. So it's on their shoulders to take part and to take ownership of what we are doing in terms of pushing out the message that it is okay to not be okay. So each week, it's typically in February around Valentine's Day, the student athletes that I work with will pick a focus area. So 2 years ago, it was anxiety. This past February, it was healthy eating habits. They take this topic and then they build a program around that for that week. If it's day by day or if it's a continuous push throughout the week, they manage it on their own with their administrators and then with the cross-campus entities. They'll bring in speakers, panels. This year it was a lot of nutritionists came in to talk to our student athletes and to talk to the community at large. One of the big pieces of it is it's a wall of kindness. So they take Post-its and write notes to each other. And then if you're having a bad day, walk by, grab a note. If you're having a great day, walk by, write a note. It's a give back and forth. And they typically put this in locker room areas or even in the community center at large for all the general students. And then again, our hashtag that we typically push out is it's okay to not be okay. And that can go with photos of the student athletes giving their own quotes about social media or, general quotes about mental health and what it means and how it is important. And we need to start having that conversation. So it's really the point of it is to try and generalize the idea of mental health is the same as your physical health. You need to take care of yourself in order to be able to compete and succeed and be the best that you possibly can as an individual. Next slide, if you don't mind. So for the conference and what we can actually do, because obviously we're not on campus, what we've done is host a mental health summit. We had two back-to-back annually, and we have now decided to skip every other year. So what we'll do is we actually partner with a mental health professional, because I am not a mental health professional and I would not want to claim to be one. But you bring in, our first year we brought in the NCAA, Dr. Hanline, Mary Wolfert, that were referred to earlier. They gave their piece of here's a best practice, here's our document and what we're finding and the different conversations in that area. And then you have your attendees who include administrators, student athletes, coaches, your faculty, athletic reps, anyone that is engaged or touches the student athletes in their day-to-day, including across campus counselors and the student affairs personnel, which is always good to have the across campus hear the student athlete difference in mental health than the general student body, because there is a slight difference in their struggles and anxiety. But so the NCAA came in our first year, did their overview. We had workshops that went along with it in our agenda planning. And then the next year we actually partnered with our sponsor, University Hospitals, and they had a doctor come in and do basically what the NCAA did, but in his version and focused it on anxiety and dealing with anxiety and how to work through some of those things. So it has been very good, and we're looking forward to next year and partnering with another group and trying to focus on whatever the student athletes decide this next summer. But again, it's have the keynote speaker walk through some best practices and then workshop through it. If it's administrators with administrators, coaches with coaches, mix up the groups, but allow for the open conversation. The coaches being there is a huge benefit, I believe, in the fact that they can hear it's not just their team. It's not just their blinders up, their world. Everybody else is dealing with it as well. And then the student athletes being there is really effective because you get to hear their perspective and what they're actually dealing with. Because after all, that's what we're actually talking about right now, is their day-to-day lives. Next slide. So the big question is, we can have these grander conversations, and obviously we still need to work on the destigmatization of it all, because it is a continued effort. We're always going to run into the wall of the rub some dirt on it attitude. So the idea is to continue that conversation, continue to gain buy-in and continue to move that forward. But what else can we do beyond the summits and the awareness week? So what we're going to try and do in the next couple of months with our student athletes as our driving force is to look at some legislation that we can put on our campuses of best practices that we can effectively mandate, hopefully. Obviously, have to go through the legal procedures for that, but see if we can figure out how to better manage things within our resources of schools, and then consider working with some K through 12 centers that are in our local areas of pushing that message with them as well. But that's really, it's a continued effort again, and it starts with the conversation. And once people feel comfortable within their own skin to have that conversation, then you can continue to move forward. But it's got to start somewhere. Thank you.
Great. Thank you very much. Very, very interesting. I want to remind everyone, if you want to submit questions, we will have time. There's a nice number of them that have come in, so please feel free to submit additional ones. Last and not least, Emily Leering from the student athlete from Ohio University. If you can go ahead, go through your slides, and then we'll get to the Q&A. Thank you.
Awesome. Hello, everyone, and thank you again for making student-athlete mental health a priority in your respective institutions and your teams. It's an absolute honor to provide student-athletes a voice on this panel. And in the next 10 minutes, I hope to provide some insight regarding the current mental health initiatives and movements within collegiate athletics today. So to begin, as a member of the Mid-American Conference, my SAC committee participates in the conference-wide Mental Health Awareness Week that Kristen mentioned earlier. This initiative focuses on a specific subtopic of mental health each year, and we vote on it as a committee of student athletes. This group specifically is an absolutely fabulous representation of collegiate student athletes, and I cannot express my gratitude enough to be a part of it. Placing rivalries and chaotic academic schedules on hold, these are the athletes at the forefront of the viral movements you see on social media, advocating on behalf of causes that are obviously much greater than themselves. So far in my personal career as a Bobcat, we focus on a variety of topics, including anxiety and healthy eating, which you kind of stemmed off as a body image campaign. Each year, we cap off the week of programming with a social media campaign personalized by the athletes from each university in the conference. And since this 2018 campaign focused on positive body image, I can definitely say our SAC program did a fabulous job hosting 3 large-scale events throughout the week that took about 6 to 7 months worth of planning, which included a presentation by a sports psych mentor and campus rec faculty member, Joe Shalero, an open mic night at an on-campus coffee shop, and a bill proposal to the Ohio University Student Senate regarding student-athlete mental health. Now, aside from the obvious central topic, all three of these events had a crucial commonality in the capacity of inclusiveness. All three events were open to non-athlete students, but not only were they open to them, but they were widely attended. And this was super, super exciting to us, and we were really surprised. This inclusivity provided our student athletes a platform to relate with and interact with general students on a level that is not only extremely raw, but is also on an issue faced by all humans, regardless of sociodemographic. And on many campuses, it's common to hear student athletes being perceived as, quote, entitled, or being the, I've had this one at me, the benefactors of unnecessary attention and financial investment. And I know I've preached to the choir in this setting when I state my frustrations with opinions like those. And while a few students spilling their hearts into a microphone on a Wednesday night might not move these mountains we talk about, I would 110% say that it builds a foundation of solidarity in a movement that, again, ultimately affects all students and communities. In regards specifically to open mic night, it was held in the Student Center coffee shop for an hour in the evening. We had 6 volunteer speakers, including myself, 2 suicide survivors, and a faculty member, to name a few. Our discussions well exceeded the hour, and we were recipients of overwhelming positivity and positive feedback supporting the continuation of these mental health focused open mic nights outside of just the week allotted to the cause. I would 100%, again, definitely encourage similar events on your campuses. It took really little grunt work. It was just a couple emails. And like all movements, a single conversation can obviously take off in so many ways, especially if you have a microphone. Arguably, our greatest achievement of the week came with the passage of Student Senate Bill 1718-15, a bill demanding greater attention be placed on the well-being of student-athlete mental health. This was the first athletics-based bill to pass through the body, and it is important to note that all co-sponsors of our bill were non-athletes. This part in our movement is especially important to me as it is in part a response to a personal loss of a teammate and a near tragic situation earlier this year. The bill specifically advocated for increased collaboration between athletic and academic administration in the capacity of prioritizing mental health resources to student athletes that are accessible, specialized, and ongoing. And these 3 points are something that I have restated over and over again whenever somebody brings the issue of mental health up, is that they must be accessible, specialized, and ongoing. And in the current form, unless on most campuses, unless deemed a, quote, emergency, whatever that means, it can take weeks to get an appointment with a counselor. And when you finally do, it's almost never with someone having the experience and demands of collegiate athletics. Now, referring back to the bill itself, its quantitative foundation rested on a 3-question survey that SAC sent out to all Bobcat student athletes, regarding their opinions on the necessity of a sports psychologist resource. Looking back, we probably should have made it a little bit more broad, but regardless, the survey consisted of 2 multiple choice questions and 1 optional extended response. The multiple choice question asked, 1, whether or not the athlete felt a teammate could benefit from the resources, and again, this was a teammate, and 2, whether or not the athlete felt they themselves could benefit from this resource. The extended response simply asked them to explain their answers, and again, this was optional. The survey had 201 total participants, which was roughly 47% of our student athlete population. And for those of you that have utilized similar surveys, you can understand how absolutely thrilled we were to receive so much interest and attention to this topic, especially on a survey that was not mandatory. Of the 201 participants, we had 119, roughly 59%, a little bit over, who wrote written responses. And when I say written, I don't just mean one or two sentences. I mean paragraphs, with a few writing multiple paragraphs, expressing their support for the addition of not only this resource, but any resource and any increased attention to this issue. In the short term, our goals for this bill include a policy rewrite to handle emergency situations such as a suicidal or otherwise self-harming student athlete. This does not insinuate a flowchart or a phone tree hierarchy, not to diminish their importance, but rather I would hope to see a task force, perhaps, formed of coaches or faculty, trainers, whomever these passionate individuals may be, that volunteer 1 to 2 hours a week for athletes to voluntarily walk into their offices or other accessible spaces on campus just to have a conversation. And obviously, this isn't the only solution, but it is one option of many that we have raised, and one that requires little to no financial obligation unto the athletic department and can easily and quickly be implemented. Now, the optimal long-term solution would, of course, be a permanent paid staff position in the training room that is normalized into the atmosphere of recovery and rehabilitation. Receiving anxiety counseling, for example, should be just as normal as getting your ankles taped or your calves rolled out. And while I don't mean to assume that mental ailments can be mediated with traditional uniform drugs, stretches, braces, ibuprofen, the availability of specialized treatment should be consistent with that of physical aches and pains. And I'm happy to report that thanks to the outstanding support from Ohio University's athletic administration and support from other faculty like Kristen Williams, we already have plans in place to create a mental health support staff position that will be specifically available to athletes on a regular schedule, hopefully within the next year. And while the logistics are still being decided, this in and of itself is a huge step forward, and I am so honored to have played a part in this movement. I would like to close with a statement again on my 3 founding beliefs in regards to student-athlete mental health resources, and I don't think I'm alone in these points in saying that they should be accessible, specialized, and ongoing. And it's up to us to continue prioritizing this issue and paving the way for other communities to do the same. Thank you again for allowing me to speak on behalf of student athletes, and I cannot wait to continue this discussion across campuses and conferences. And with that, I will turn it back over to Mr. Goldman.
Great. Thank you very much, Emily. Really appreciate it. So let me start going through the questions here. Victor, I'll start with you, if that's okay. There's a few questions going back to the statistics that you show, and the question is really, are you saying that student athletes struggle with mental health more than most other students? Is the data show that is the situation?
No, actually, what I was saying is that there are reasons to suggest that as a group, student athletes may have less frequent mental health problems than others, that their complaints seem to be somewhat lower. There are exceptions to this, again, and this is data you can find on the NCAA Sports Science Institute's website. But their rates of anxiety and depression seem to be somewhat lower. There are concerns about increased rates in substance abuse, and interestingly, one problem that seems to be somewhat unique to athletes is a problem gambling. And even more strangely, last I had conversations with folks at the NCAA about this. It seems to be uniquely common among golfers. So there are these particular concerns that are unique to athletes, but as a group, they seem to have slightly lower rates of most mental health problems than college students as a whole.
Okay, thank you. Kristen, a question for you. You talked about the need to reduce stigma, and I'm curious about when it comes to coaches, trainers, people in the athletic department, do you feel that they are open for having these type of discussions, to having this type of role? The data that Glenn shared was about students. So I'm trying to get a sense of the administration in athletic departments, whether they do understand the need to be involved and are willing to start becoming more and more active in this.
Yeah, and I think that honestly, it just takes time. And the more you see Kevin Love come out and say that he's had a mental health illness, or any of the pro athletes actually make a statement in that effect, that's been a benefit. Through our conference, at least, the fact that we've been able to continue this conversation, have had the support of our presidents and our athletics directors and so on, the continued commitment to it and continued conversation has opened the eyes, per se, to coaches and the administrators that this is something that is happening. And I think the fact that we've been able to have this as a continuous thing, it makes the student athletes feel as though, okay, maybe I can have this conversation with someone. I know from my own personal conversations with a number of coaches, they've seen it come up more and more, be it anxiety, depression, suicide attempts, eating disorders, whatever it is. They've seen it happen more and more within their student athletes, and their teammates are actually going to their coaches and giving their coaches a heads up of, a certain individual's not okay, or we're worried about someone. So it does take time, but I think if you continue to sort of beat the door down, it works eventually.
Emily, has your experience been the same in terms of this increasing awareness on the staff, on the trainers, on the coaches?
I would say so. I mean, specifically at Ohio University, I think we've invested quite a great deal of time and resources discussing this topic and what kinds of long-term and short-term solutions are not only possible but will be utilized by student athletes. So I agree with Kristen. It definitely takes time, but at the forefront of the movement is having administration that are open to these conversations, that will provide the prioritization and then consequently the legitimacy to this issue, that will hopefully then encourage coaches and teammates to take it up as a topic to really tackle with their team.
Right. Victor, a question for you about who, when we talk about general student mental health, in most cases it's the counseling center, VP of student affairs, who gets involved, understand the need, looks at different strategies to adopt to address it. When it comes to student athletes, is it the same individuals, or is it more the athletic department itself that is really the point person? Who is really the people who are concerned and actually ends up investing time and efforts in addressing this?
Yeah, that's a great question, and to some extent it depends on the size of the school and the I guess prominence and size of their athletic program. So that in bigger schools and state universities with 40, 50,000 students with large, well-developed athletics program, there may actually be a mental health clinician who is part of the athletics department. That has its benefits in terms of access to care. It actually can have its drawbacks if that person isn't really well coordinated with the other mental health resources on campus. They may not be completely using some of the specialty services and some of the backup and support services that are available to students as a whole. So they need to be well integrated. In many cases, also larger athletics departments, and here we're not even speaking to such a large group, but they often have advisors, often from the academic side, who are dedicated to the student athletes, and frequently, if they're doing their work well, get to know the student athletes well and can be a really very valuable resource for getting student athletes into the mental health system, the regular counseling service, for the more typical place that doesn't have a dedicated counselor. I will say that it's valuable to have someone, one or two people in the counseling service, again, depending on the size of the institution, but to have some people in that service who are well versed. I think both Emily and Kristen mentioned the importance of having folks who really understand some of the particular challenges and stresses and concerns and strengths as well of student athletes who can also begin to develop a relationship with the athletics department. I think that leads to a diminution of stigma and an increase in trust when trainers and coaches and people in the athletic department administration and the students get to see that there's a go-to person that they have a level of comfort with because they've really worked with a number of the student athletes.
Great, thank you. Glenn, a question for you about the survey that you collected. So in this table, it shows that a majority of students, whether they're freshmen or senior, have not approached anyone in the prior 2 months or so to talk about a referral. But at the same time, it's a small percentage, but there is, anywhere from like 2.6, 1.5% that have approached 4 and more. So I'm just curious, do you have a theory about why certain students, I know it's a small percentage, but honestly in some very large schools that actually adds up, why certain students are so active and at the same time so many are just completely not active at all?
Wow, that is a great question. I'm also going to ask the other participants to add any answers I may have. But looking from the data we have, we see an impact of, like, say, gatekeeper training to be equally effective depending on race, ethnicity, depending on whether you're a freshman, sophomore, senior, and so on. So my guess is that those that are on the 3 or 4 are potentially have less stigma. They're less threatened by the idea of having a mental health problem. They feel more comfortable going to their buddy. Perhaps they, in the transition from high school to college, have been better prepared in terms of mental health. It's a really hard question to answer because there's not, in my mind, any really good data about that. Victor, do you have any thoughts about that?
Yeah, since I'm not a researcher, I'm not constrained by data, so I'll just suggest some. There do seem to be in any group people who are more comfortable being helpers, so it may be that someone who is both vigilant around their teammates and friends, and it would be great if these were captains of teams, but it's not always the case that the captain is sort of the emotional leader of the team. But I think there just are people who feel more comfortable with that role. And it may be the case, and actually this is something for Glenn and your group to think about, that it could be that if we can get people to intervene once and they see that it's not as difficult to do as they may have worried it was, they're inclined to do it more consistently. So that there's this kind of threshold or barrier to the initial intervention, but you see you can do it and you keep wanting to do it because it actually feels nice.
Thank you. Kristen, a question for you around ROI. There's a good question here about how do we get an athletic department to buy to the ROI that mental health really supports and provide for them better outcome. Any thoughts on that? Let's assume that not everybody will understand the need and we'll need to see more hard numbers on how implementing mental health programs will benefit outcomes, whatever way they define it. Any ideas on that?
Yeah, that's a tough one, because then you have to play the political game a little bit. So within our 12 institutions, there have been a few that have taken it upon themselves, specifically through either the trainers, the athletics trainers, or the faculty athletic rep who happens to have a psychology degree and works in the psychology department at the institution. They did a survey, sort of a beta test of where all the students athletes were at. So very similar to the results that you have in front of you now. It was sort of the question of, have you ever felt depressed? Have you ever felt anxious? Have you ever considered suicide? Have you talked to anyone that's considered these things? And put the numbers together and presented it to their president, their athletics director, their general counsel, in all honesty. And that initiated a need on campus and realization that resources were too limited for what they're, not only student athletes, because if you think about it, student athletes are actually sort of the guinea pig of the general student population, as they're a smaller subset. But the general need was shown through these numbers of answers, and it was an anonymous questionnaire, and give credit to the student athletes, they answered it honestly, and the need was shown that the numbers were high enough, they needed more attention, not only for the general student body, but also for the student athletes. So when you put stark numbers in front of someone, especially general counsels, they're going to look at it and say, liability. We know about it now, we need to do something. Obviously, that depends on your general counsel, but that is one way to do it. The other way is, unfortunately, instead of a proactive approach, it's a reactive approach. Unfortunately, if you do have a situation that is a suicide, or there is a general tragedy that everyone feels, then attention is drawn to it, and it's easier to move the needle in that way.
Right. And if I can add something that we do with our kind of campuses we work with, where they adopt one of our simulations around for the general student population, is that we use a lot of the study from the Healthy Minds that was done at the University of Michigan, that shows that 6% of the students who do get help at a counseling center or receive mental health support will not drop out of college or the university, as a way to say that, if you look at the number of increased students who are coming and getting help, and you assume that 6% of them will not drop, you can actually do a dollar calculation to the value that those additional referrals resulted in. So that's one way that we help schools do a bit of a calculation, which is really about the fact that they can avert lost tuition, which is in some cases very, very appealing to them. Emily, there's a few questions here that I think will be best for you to approach. And the questions really are around whether we should even ask student athletes to be active in seeing when friends are struggling, and have them, approach their friends and peers and talk to them about seeking help, whether we should even ask them to have that responsibility. I know what the research says, but I want to hear from you as a student, whether you agree that we shouldn't do that and we shouldn't expect students. Why are we asking them to do something like that?
Well, I would pretty much agree with what everyone else has said, in that there's a clear, I think the number was 88% of respondents of that particular survey said that it was a part of your obligation as a teammate to talk with your coaches when you felt that one of your athletes was experiencing some sort of mental duress. And being a collegiate runner, obviously eating disorders are silent killers of many seasons. And I've seen it time and time again, not only on my own team, but on teams in the conference. And I mean, our coach isn't around to watch us eat, other than when we're traveling for meets. And even then, you're hiding behind the bus or bus seat. so I think it really is on each other and on our roommates to make the first point of interaction being just, hey, as your friend and as someone who cares about you as more than just a pair of legs on a track, like, I noticed that something's been a little off lately. And having that conversation with them until you see that it's either not working or they're not receptive, and then you have to move on to the next step, which would be to talk to the coach or assistant coach, whoever is that person's most immediate athletic contact. But all in all, I would agree with what we've said so far.
Great, thank you. So we talked a lot about the fact that, for example, in a counseling center, it would be better if the person who is helping a student athlete has the relevant background, right? So as Victor, as you said, there's a better trust. Emily, you mentioned just a better understanding of the collegiate experience. I wonder, Glenn, for you as someone who's involved in creating training and learning experiences, do you think that that carries into that as well, meaning that you cannot use a general student program for student athletes, and it has to be highly tailored? If you can just touch on that.
Sure, and Victor, excuse me for depending upon the data here, okay?
That's okay.
There's two answers to that question, yes and no. The generalizability of the learning design is in part due to the fact that you're teaching evidence-based communication strategies that reach across cultures and ethnicities, mostly like, say, motivational interviewing, emotional self-regulation, mentalizing, etc. So when you combine those learning strategies with the neutrality of virtual characters, you have increased your chances of generalizing the learning experience, and the data bears that out, where we see in a large sample, like 63,000 students, you can cut the data in terms of not only student athletes, but Greek life, whether or not you're an international student, race, ethnicity, you look at it. And the learning outcomes are pretty identical, and they show, an impact. But with that said, if you customize a program that are specific, like say to student athletes, there's nothing standing in the way saying that the program is going to be even more effective, that athletes are going to relate to it in a more intimate way. It's going to generate the capability of that athlete to be able to engage in more empathic responses, facilitating the communication. So that's both the yes and no end of the answer.
Right. Okay. Thank you. Kristen, a last question for you here. As we're talking about this and we're, understanding the need for increased attention to student athletes, clearly a lot of work has been done by organizations like the Jed Foundation and others around general student population. It's, very well accepted in higher ed that it's a topic that needs to be addressed. Over the last few years, more attention around student veterans, LGBTQ students, and now more attention around student athletes, all clearly needed, and the data clearly supports that. I wonder, from your perspective, what do you think is really the one thing that has to happen for this to really become a top of the agenda item for schools with athletic departments?
Honestly, it is what I believe is going to be the driving force behind it all is going to be the continued openness from those that are in the public eye, and having perhaps a president of the university, come out and say something along the lines of, we are dedicated to mental health services. We are going to make the experience of our students an overall concern for us and make it a forefront issue. It's not, the behind the scenes efforts has been fantastic, and the continued data and the continued social media conversations, but it's going to take someone that is willing to do it to come out and make that statement that it is a driving need. And ideally, it would move into the K through 12 situation as well, because it is starting to populate there more frequently and more well known now. So it would be great if it was not just a college setting, but an overall overarching message of our young population needs this help.
Great. Thank you. Thank you, everyone, for joining today. This was very interesting, and I hope you found that interesting as well. We will be sending everybody a link to the recording of this webinar. And we had almost 500 people that joined today. I think another clear indication this is a topic that needs attention, and there's a lot of people who want to be involved and support it. So thank you, everyone who joined. Thank you for the panelists. Thank you very much. Bye-bye.